While the patient is under general anesthesia, the esophagus device, riding over the endoscope, is gently glided down through the patient's mouth into the stomach. The stomach is inflated, and the endoscope is advanced and turned so that it is looking up at the entrance to the stomach. This is where the anti-reflux valve will be created. The tissue mold is then advanced into the stomach. The tissue retractor is engaged at the Z-line, a line that marks where the esophagus and stomach come together. The tissue is retracted into the tissue mold. Some patients may have a small hiatal hernia, a condition where a portion of the stomach has migrated up through the diaphragm into the chest cavity. If present, hiatal hernia can be reduced, and the esophagus can be lengthened by retracting the endoscope up into the esophagus. Suction is then engaged, and the stomach is then repositioned down below the diaphragm. The esophagus device is then rotated, wrapping the fundus toward the lesser curvature of the stomach. Under visual control, the esophagus device is then used to deploy two H-shaped fasteners to hold the fold of tissue in place and maintain the wrap. The wrap is then tightened further, and the next pair of fasteners are placed 1 centimeter above the Z-line.